All right, welcome back. After a week hiatus, we are back this week again with our weekly Native Strong Town Hall on the COVID-19 pandemic and the response in the Native community in Wisconsin and the Bemidji area. Our featured speaker, Dr. Lyle Ignace, had a nice, much-needed week of vacation last week, so we were not with you, but of course, we're glad to be here again. And since we were not around last week, some things have changed. The eligibility of vaccines has grown to a pretty wide range or wide audience, almost everybody, and also cases have been on the rise. So we will tackle those subjects today. And of course, our good friend Mark Denning is here as well with us, help us moderate. But for those who have joined us previous weeks, we welcome questions. We love having your questions. They help the show kind of go along at the end. Really want to get the input and the feedback from the community. So if you are joining via Zoom, you can enter a question via the chat bubble or chat box, which would be at the bottom or the top of your interface. If you are joining us via Facebook Live, just drop in a comment and we will moderate those as well at the end of the show. And once again, like I said, our friend Mark Denning is here, so I will pass it on off to him. And thank you all again for being with us.
Wirabushu and we magana duk Madawi Benezi indigenous cause Name and Dodem. On a Schnabe, Homanomenik, Lenape, Delaware, Mohikanak, Molax Ojibwe, and Dow. Neopit Indon Jaba, descending from all of those tribes that I just mentioned in my own ancestry, probably more. And glad to be here, everyone. We did have a week off. I think we were on for about 53 or 54 weeks straight with no breaks. And one was taken last week, so much needed break and appreciated. Unfortunately, this program still needed, and I'm looking forward to the day when it's not, but there are a lot of questions, probably even now more than even in the beginning, because we're in that in-between place of COVID-19 rising, as well as the medication to help us rising in its availability. And there's some challenges that are personal in nature, challenges that are also professional. And we're glad you're here. If you have a question, just move your cursor around a little bit if you might be here for the first time. And you'll see a bar pop up either at bottom, side, or top of the screen, depending on how you have it arranged. And you'll see a chat, looks like a little bubble. You just press on that. And once you click on that chat button, another screen will pop up. It'll say chat right on it. And it'll say everyone. And you can write a message there. You can write a concern. You can write a question about what we're talking about. And we are talking about COVID-19 and the native to native situation. We know that we were facing some pretty dire statistics. And we're hoping that the concentrated work that's been out there on behalf of Native people is making an impact. And we can see it. It can be measured. And that's why we're here. Where are our strengths, where are our weaknesses, where we need to be working, what do we need to be doing? There's a lot more people out there interacting. One of the larger pieces that has happened here in the state of Wisconsin is that our mandate has been lifted for masks. So the governor had set out a proclamation, a directive to the state of Wisconsin that people should be wearing masks. That has been lifted because of the laws of our state as interpreted by the by Wisconsin Supreme Court. So one of those larger events that we had this week was voting. And in the place where I voted, I would say that a minority of people that were coming in were maskless. That a majority of people did have masks, but I would say maybe about a third did not the time I was there, which is a lot. Also, the people that were working those voting booths were not masked. Some were, a majority of them were not. So we remember during our last election, all the precautions that were taken. And now it seems like, do those precautions even exist? So if there's this haphazard approach that exists now in a checkerboarded way, how can we protect our families? Where are those places of concern where infections are spreading? That's just some of the reasons why we're here. So I'm going to turn this over to Dr. Ignace. He's going to let us know what the center's been doing, the challenges they've been facing. And lastly, I'd like to share that I myself have been given a vaccination. I got mine this week. It was great. It was like a trip to the store in a small town. See a lot of people we haven't seen in months. And it was really great to feel that. But we were also there in the same cause of health and protecting our elders and fragile and even ourselves. So with all of these things in mind, Dr. Ignace, I'm going to turn this over to you for some much needed updates over the last couple of weeks. And thank you for all the work that the staff is going through. And it can't be easy. I know for every successful inoculation, there's probably somebody out there that's saying, you didn't get me.
Yeah,
So
right.
we got to get to our best we can. So Dr. Ignace, you're on.
Thanks, Mark, and welcome back, Jeremiah. Good to see you. And you know, it was a much needed break. I think just to take a time out. So, you know, gathering this information for everyone does take time because everything that's been going on lately, things are flying left and right, and new stuff, new numbers, new everything is starting to pop up all over. So when I was sitting down going over information that I presented, you know, 2 weeks ago, you know, things have changed. And so as things change, I want to be able to assure that we get people updated to the latest of information that's going on. And so this slide right here really outlines the predominantly 5 vaccines that will be prominent in the United States. AstraZeneca and Novavax, the 2 on the right, they're still in clinical trials here, and they will be out. Just not yet. So, but we have Pfizer, Moderna, and Johnson & Johnson, and the latest updated information. As you go through these blocks, do look at it from left to right. So on the left, this is symptomatic COVID-19. So anybody who becomes ill with COVID, we have the type of virus and the variant in that second column. And then we have what each vaccine does and how efficacious it is for each of the variants. So as we go through, let's just go through Pfizer real quick. So in the clinical trials, we all heard about 95% effectiveness, but when we start looking at in the real world activity, we see that it is 91 to 85%, 91% effective, 85% after 1 dose. So this is information that we're getting, studies, results, what we're getting out of Israel. 90% effective here in the United States, 80% after 1 dose. And currently, adolescents are showing 100% effectiveness in prevention. But this is still in the clinical trials. So as a scientist, as a health provider, we know that all clinical trials in real world are a little different. So very similar profile with Moderna. When we get to Johnson & Johnson, J&J, very different profile in its effectiveness. So at least globally, it's reported out about 66%. Here in the United States, it's 72%. But as we start going down and start looking at some breakouts, so if we look at how it's effective against 65 and older, we see that here in the United States, 92.9, like essentially 93% effective in 65 to 75. Ages 75 and older, 100% effective, 100%, 75 and older. Moderna, 100%, and again, globally for J&J, almost 69%. Now, when we start looking at the variants, the UK variant, the B117, really no impact on its efficacy. It's really essentially the same. When we start looking at the South African variant, the B1351, again, we're seeing, yes, there is a slight decrease in the antibodies, but when we start looking at the impact, what does it really change the efficacy? And the answer is coming out. Essentially, there's no impact on the efficacy. And that's really because, and this goes to biology, human biology, our immune system, and our immune capability to mount a response. So if individuals who've gotten the vaccine, there is an immune cell called the T cell. The T cell acts as kind of a memory bank. So these are our kind of our first line of defense of responding to any foreign substance in our system. So as long as we have a functioning T cell, we are vaccinated, these T cells in our bodies mount a response. And so this is very similar to what we see with the P1 variant, the Brazilian variant, and something new that's coming up that will be coming up with more attention is this double B1427 and slash B1429. This is a variant that has come out of California. I bring it up now because it is going to be significant here in Wisconsin. So, but the general sense right now is that it is, as long as there's a vaccine for individuals and our intact immune system, T cells, that individuals will have an effectiveness against the variant. So now, when it comes to severe COVID, it's shown to be quite effective in preventing hospitalizations with the virus, as well as against the South African variant. Same with Moderna and Johnson & Johnson, and this is really its short and long-term effectiveness is 85% after 28 days and 100% after 90 days. Now, what's new, and I know this question always had come up kind of in the early beginning, is what is this, if people who get vaccinated, are they at risk of transmitting disease? And what you see in this yellow highlighted box is that the asymptomatic reduction or the transmission of coronavirus, and it dramatically goes down. Some studies have reported 72, 95% effectiveness in not transmitting virus. Moderna studies have shown a little bit less in its profile. Johnson & Johnson, 74%. So I would say roughly at least a 75% chance of reduction of this. And so that's actually good news for individuals who've been vaccinated, and if they're concerned about transmitting as an asymptomatic carrier to transmit it, and the answer is for the most part, no, you're not at risk of transmitting the virus. Now, everyone's wondering about pediatrics, what's going on with the pediatrics. So enrollment for Pfizer has closed. And like I mentioned before, their clinical trials of 12 to 15-year-olds had shown 100% effectiveness in preventing COVID. That's with Pfizer. With Moderna, they're still enrolling. They're looking at profile 12 to 17. Johnson & Johnson is enrolling individuals, and they're looking at kids at 6 months to 11 years of age. So we have this very broad spectrum. You know, Pfizer, 12 to 15. Reason why it's only up to 15 is because they studied originally 16 and older. So this is just extending down to teenagers. Same with Moderna. But I think what would be most interesting here is with Johnson & Johnson. They're doing the 6 months to 11 years of age. If this looks like a vaccine that's going to be effective in our pediatric and adolescent kids, that may be the vaccine of choice for our younger population. So I know this is a lot of information, and it's important because we hear all of this. I just don't know if it ever is summarized in this, in a table like this for you to actually view. So now, why did I bring up the double California variant? So as of today, the states has sequenced 9,322 positive COVID tests, and this is over several months. So here are the breakouts. The variants that are showing up are the P117, the UK, the variant B1351, that's the South African, the variant P1, that's the Brazilian, and this double or dual variant, the B1427 and 429, that's out of California. Now, what's interesting here is that this has really come out of nowhere. 2 weeks ago, this didn't really even exist, or it was on the radar, but not in Wisconsin. But the fact that the sequences in the last couple of weeks have shown this variant tells me that this is going to be probably the more predominant variant here in Wisconsin. So what I've done here is, when you look at the table with the red circles on it, if you go to the far right, you'll see the total number of sequenced. And it goes by regions. So of the 291 sequenced in the Fox Valley area, the other lineages, the 95.7, that's probably of the original. And then we have the breakouts of all each variant and what the predominance of it is in that region. So I, in my unruly way of trying to tell you where these variants are in the regions, I threw a map up on the right-hand side. So you see the Fox Valley in the western area, as well as the north central area. These are the UK variants. That's the predominance variants in those regions. The CA, and this is what is probably the most predominant variant that I think we all should be really looking at, is the California variant, and that is in 4 regions. So in the Northwest, Northeast, the Fox Valley, I'm sorry, not the Northeast, South Central, and Southeastern portions of the state. Now, what's interesting here is, you know, as this variant wasn't even present 2 weeks ago. And when I looked at even data this morning, this popped up. And so what's interesting is, if we look at the 9,322 sequenced COVID tests, we see that the California variant is the most prominent right now at 2.3%. So when I go back to this previous slide here, that's why I put in that one line, the 427 and the 429 California variant, whether the vaccine has efficacy against this virus. The general sense of it is that it does. I can't quantify a number for you, but the general sense is, yes, it will work. We just don't know how well it will work. If it is more than 50%, I think everyone should take comfort in that, that it would be effective. If it is like 20 to 30%, that is going to be the variant that will escape the vaccine and could lead to a more prominent surge here in the future. So it's reason to be concerned, because, like I said, 2 weeks ago, this variant wasn't even on the map. 2 weeks later, it is and now is the #1 variant in the state of Wisconsin. So that is new. That is new. Just to shift gears, I wanted to kind of give some insight as to what's going on. I talk a lot about the area. I don't talk much about what's going on worldwide. So when I look at what's going on globally, there's a couple of countries, obviously the United States, everyone knows about what's going on in the United States, but countries like China and India, these are the #1 and #2 most populated countries in the world, followed by the United States. So what's going on in India? So we see India had their major surge back in September, October, right? Certainly before we did. They started going down, we started going up. Now, what's interesting is, if we look at India, and has a population of almost 1.4 billion people, they're now going in their second surge, and it is worse than their first one. Now, I am not too familiar with India and its vaccine efforts on a national scale. But the fact that they are essentially outpacing the United States in the number of cases per day, my sense is that India may be heading into a very serious and more critical surge than what we had actually seen here in the United States. Now, right now, we're here in the United States, we're averaging about 70,000 cases per day versus India, 100,000 cases, and they're going up. We've kind of plateaued and kind of flattened here. They're on their way up, and that's a big concern when we look at things globally. Now, I wanted to bring this up because this is looking at two countries, Israel and the United Kingdom. Now, if people are following what's going on globally from a vaccine standpoint, the UK, obviously they are kind of popular for the variant, and the first variant that came out was the UK variant, as well as what's going on in Israel. You see that they had surges just like every other country has, but what you see is this really steady decrease in the number of cases. Now, I think what people have to realize is countries like the UK and Israel had massive vaccine campaigns. So much so that a good portion of these countries' population have either gotten it or have gotten vaccinated. So they have those countries have really done an awesome job in assuring that their individuals had access to the vaccine and got it. So when we look at Israel, 8.7 million people, and they're averaging 317 cases a day. That's not 3,000, that's 317. 317 cases a day right now. The United Kingdom is 68 million people, 2,400 cases today. And the UK just came out today with an announcement saying that they've reached, or they will reach, herd immunity of about 74-75% as of Monday. Based on their models and their projections, they're looking at reaching their herd immunity. That means 75% of their population has either gotten COVID, or has gotten the vaccine. And as a result, you can see what the UK's effort has been, and their numbers have dramatically decreased with their effort. So that's what would be to be expected as a result of a community or a country doing a massive vaccine effort. And so that's why I wanted to show this as a direct result of that effort. Now, bringing it back here to Wisconsin, bringing it back here to Milwaukee, I wanted to show you this slide because, you know, for the last month, I've been really trying to push our effort to support the community by offering vaccines to the Native community. We've hosted two events. The first event was March 9th through the 11th with a Moderna vaccine, and then March 23rd to the 25th with Pfizer. Now, when you look at this graph, you can see as this goes back to December 15th, and the line, the brighter yellow line is American Indian Alaska Natives, and you can see how the vaccine, first single dose rate of vaccines for Natives coincides with everyone else and here in Milwaukee. So as time has gone by, you see that there's some separation of vaccines based on ethnicity and race. And then we get to March 9th and 11th, that week, those 3 days. That was an effort by GLIC to vaccinate nearly 500 people. And you can see that as a result, the rate of vaccination of Natives in Milwaukee had dramatically increased. In fact, it increased so much, almost by 350% in 1 week. And I'd like to at least say that I feel is a direct impact of our effort on the Milwaukee community. Then it went down. As you see, the line goes down. That was the gap in 1 week. And then the line bounces back up. So now that is the week of March 23rd, 24th, and 25th. That's where we did a second round of vaccines for the Native community. And you can see that our rate is still at a very high and comparable to non-Hispanic white population here in Milwaukee. So I wanted to give this as an update, and it's hard to, you know, I can just give you a number, but this actually shows kind of a direct correlation between our effort and the community, Milwaukee community, in its effort to get people vaccinated. So kind of nice to be able to show this in one slide, and you can see for yourself that the Native population has certainly stepped up to get vaccinated in those 2 weeks. Now, what's going on here in Wisconsin? We see that the single dose of the state, almost 2 million people have received at least a single dose, 34.1% of the state. I look more specifically at the racial and ethnic breakouts, and I look at trends, what's going on. So we have the aggregated total single dose for for every time I give this presentation, I give you an updated number. And what's in yellow is the difference between the weeks, how many new new individuals have received at least a single dose by race, and the rate of change in the past week. Now, when you look at this, you'd say, well, you know, Native population, 21%, that sounds great. That looks good. However, when you start looking at the trend, of February 24th, we'll just look at our Native population. We see that within the state, this is within the entire state, 776 individuals got vaccinated. When we look at March 3rd, almost 1,500, March 10th, 1,500, March 17th, 1,700, March 24th, 1,600, March 31st, 1,600, and then we start to go down. to 1,300. Now, when I look at this, and when I compare this and look at other racial groups, we see that other racial groups are going up. Everyone is going up, and the Native population is starting to go down. I think the early successes of vaccine, I think, had to do with the distribution of the government to the Indian Health Service up front. And obviously there was a demand. We had the supply, and it was being distributed. And as everyone else kind of caught up, that demand and the supply started to be more widespread. People have more choices. They have more options to where and when they can get vaccines. My only concern here is that the rate of change in the past weeks, and you can follow it directly here on the far right, you can see there's a direct correlation between that early success of the rate of change back in early March was almost 21%, and now has dropped off to single digits of almost 9%. So, and then you see everyone else on the rise as well. So my concern is within the Native community here in the state that the demand, it's not a lack of supply. The supply is there. It is now the demand for the vaccine has weaned off, and that's concerning. But there is a silver lining in that, and I'll get to that as I go through all this. But my concern is that the need or the wanting demand of getting the vaccine is starting to go down in the Native population. This is just looking at second dose and how this compares to other racial ethnic groups in the state of Wisconsin. This is really more of a reflection of the early successes of tribes in our urban program here. I anticipate that this will start to decrease as well in the next week or two. When we look at the state as a whole, we see that nearly 3.2 million doses have been administered here in Wisconsin. And as of right now, the state of Wisconsin is averaging almost about 55 doses per day. So that is a good indication that overall the state is incrementally increasing, and the demand for that vaccine and supply of effort is matching that right now. When we look at what's going on throughout the country, we see that this is the United States. The 7-day average right now is 2.8 million doses that are given, and so you can just see that that red line is the 7-day moving average, and you just get a general sense that the amount of vaccine that's being given is obviously being administered throughout the country. So that is good news. When we start looking at what's going on with the population as a whole, we can now say fully vaccinated, almost 20% of the population is fully vaccinated. Individuals that are 18 years of age and older, almost 25%. The more critical age group is the 65 and older. We see that nearly 57% of the population has now been vaccinated. So this is all good on and trending upwards, and that's what we want to see what's going on here in the United States. What's going on with administration? So the rates of administration by jurisdiction. I've been tracking this as well over time, and as I got a little discouraged by this because I saw that the Indian Health Service, as in the very beginning, as one of the federal agency, was getting a good allotment of vaccine, and the rates were really high. But over the last couple of weeks, that rate is starting to go down, and go down so fast that now it is ranked 41 out of 64. Wisconsin is moving upwards. Minnesota is moving upwards. Michigan has remained flat. And so this is important to keep an eye on at rates of immunizations and how people are receiving, populations are receiving their vaccines. And it's kind of an eye-opener when you start putting all of these pieces together, and you can get a sense of what's going on in particularly Indian country. So when, again, this is another table that is looking at COVID cases in Indian country. This is the Indian Health Service reporting out by area the number of cases. And so even though I didn't have a presentation last week, I did keep up with the numbers, so when I came back, I at least could give you accurate information. So as of April 6th, 2 days ago, the rate of change, the number of new cases in the past week showed increases in Alaska, Albuquerque, and Bemidji, Phoenix, and Tucson. Now, there's now 1,048 cases in new cases within the Indian Health Service. Now, what's really, that's the bad news. And so last week, the week I didn't have a presentation, March 30th, we were at 699. So this week breaks that trend. And so up until then, 11 straight weeks of downward trajectory numbers in Indian country. And then we see this uptick of cases. Now, is this a trend that's going to continue? I don't know. But when we look at this and say, gosh, more cases, more native cases in Indian country. When we go back to this slide and you see that within 2 weeks, we've gone from going down to now going up. You can kind of see, well, IHS is now ranked 41 out of 64. That's down from 27 that we've decreased in 20, from number 24 down to 41. Does that have a correlation of COVID remaining in Indian country? And the answer is obviously yes. It is lingering about, and when we look at Bemidji, 254 cases, when we look at what's going on in our region, when we look at what's going on in our region, Michigan, Minnesota, Wisconsin, so the new cases, so of the respective tribes in each state, I give you the total number of cases. In parentheses is the total number of new cases that are going on in the past 2 weeks, not 1 week, but 2 weeks. So now we see 296 cases in Michigan, 201 new cases in Minnesota, and believe it or not, Wisconsin has only shown 20 new cases. So how can that be? How can that be? I don't think we're necessarily doing anything different than other tribes from the other states. I mean, could it be from our respective tribes here in Wisconsin and our rates of immunization? It's possible. I don't have that breakout. Could it be, we had talked about an event that occurred in Minnesota not too long ago, 3-4 weeks ago, and maybe it was a little premature to do this. There were outbreaks of COVID that occurred in Minnesota. So there are all types of mitigating factors that are going on. And where are these new cases coming up? I suspect they are coming up in our younger population, not so much our older population. I think it's because of our younger population. This is IHS looking at the 7-day rolling average of positivity of cases. So if we look at the line of Bemidji, 9.2%. So that's significant. And when we look at the transmission of infection, Bemidji has the highest rate of all areas, all IHS areas in the country. So something is ongoing that hasn't changed. Everyone else has plateaued or has remained on the lower end of transmission. But Bemidji, the area, Michigan, Minnesota, Wisconsin, has the highest rate of all IHS regions. So I wanted to bring that to your attention as well. So every once in a while, I'll look at what's going on with each state, what's going on with each tribe. The state positivity rate, this is overall population state. Michigan, 15.6, Minnesota, 7.8, Wisconsin, 3.3. I don't know if people remember this, but several months ago when we were talking October, November, December, that's when Wisconsin was going through its high surge. And when we looked at comparing it to Minnesota and Michigan, they weren't doing that. And my point was that Wisconsin was one of the hot spots in the country. We were going through that early surge first. Everyone else hadn't gone through that surge. And now it has flipped. Wisconsin is on the lower end, and now Michigan and Minnesota are now having concerns with their state positivity rates. And again, when we look at the tribes, again, the same thing. Back October, November, December, Wisconsin's tribal positivity rates were sky high. And now that is flipped. So we are now on the lower end, and Michigan and Minnesota's positivity rates in tribes is now higher. So there's a lot going on everywhere, and it's 2 weeks off. Taking a week off, you can, if you blink, things can change very quickly, and things have changed quickly. Here in Wisconsin, we now have a 7-day average of 657, and that is about 2 weeks straight now where that change has occurred. We were at that plateau, and it just couldn't break that the floor there and squash this virus. So we're losing ground, is what I'm getting at. We're losing ground, and as a result, so in Wisconsin, American Indians 1.4 times higher case than non-Hispanic whites. When we look at hospitalizations, the rates second in hospitalizations. Now, what's concerning here is the rate of hospitalization. The difference between American Indians and Blacks is that change, that difference, that gap difference, that rate difference has actually decreased from 26 to 14. And that is a trend that is starting to go up for Natives. It's a trend that you don't want to see. You'd rather see the differential get wider, but that's not occurring. It's actually getting smaller, which would indicate that something is changing and not for the betterment. When we look at death rates, again, there are changes that are occurring in the Native population in the state of Wisconsin. I reported out 2 weeks ago that was 1.5, now it is 1.55 times greater than non-Hispanic whites. Compared to Blacks, 1.4, that's increased, 1.9 greater than Hispanics, that is increased. The rate of death increased difference of 40 to 50 to the Black population. That is also not a good indicator. You'd actually want to see it going down, but instead it's starting to widen. So case rate, hospitalization rate, and now the fatality rates are widening, which aren't really good indications. So I know I usually end with this. It's a lot. I have to catch up with people, and it really highlights kind of where this is all occurring, what's going on. So in the past 3 weeks, there has been a trend, an upward trend of cases. So in that top row, March 24th, 3,000, almost 3,200 cases. In March 31st, 4,800 cases, and April 7th, 7,900 cases. And so when we look again at that age group, 65 and older, who we know that the vaccines have the greatest benefit, we see that even though the rate of 65 and older is going down, the overall number is actually going up, as well as the number of hospitalizations, ICU admissions, and also fatalities. So while our older population may be getting the vaccine, there was a window about 3 weeks ago, a window of opportunity, specifically in the Native community, that if the vaccine was to get into high-risk groups, that it could continue this trend, a downward trend of not only COVID infections, but also hospitalization, ICU, and fatalities. We're kind of beyond that window. So we just kind of missed it. Now, it's all about catch-up right now. In the last couple of weeks, we see that here in Milwaukee, like the Wisconsin Center has opened up, daily vaccines in mass numbers. We see hospitals, we see, schools open up vaccine efforts. And and now this past week, the eligibility has opened to just about anybody, 16 and older can now get it. Well, I guess the question that I have in looking at the numbers, this trend was going on 3 weeks ago, and 4 weeks ago, that opportunity, we started the vaccine campaign on March 9th, 4 weeks ago. That was the window of opportunity to start looking at how we, GLIT, could drive these numbers down. And I think we got into the Native community and had that opportunity to drive those numbers down. And we followed it up with a Pfizer campaign March 23rd. Now, the reason why there's a little bit of a silver lining in this is when you look back, right here, when we look at what's going on comparatively of Native tribes to states, we see that the rate of increase has dramatically gone down in the state of Wisconsin. And the number of cases, of Native cases in Wisconsin, has dramatically gone down. That was not the case, 3 and 4, 5 months ago, where Wisconsin was, leaps and bounds ahead of, Michigan and Minnesota. That has now completely reversed. And so could this have been just the natural progression of COVID moving through our state? Possibly. And after that surge, we now introduced vaccines into our Native community. Had that had a profound effect on the rate of infection? And the answer is probably yes. I can't quantify it, but that's what I'm seeing. So a lot of information. I had to get people caught up. Mark, Jeremiah, if there's anything that's come through, questions, comments, thoughts, let's open things up here.
So we got a couple questions from the others watching. Please weigh in on the comment section in the chat box. One is about youth sports and the baseball season for young people. Some districts are practicing, others are not. Games are scheduled within a week or so.
Mm-hmm.
Any kind of recommendations you can give us for those kind of under, well, let's get specific to when I was asked, the under
12?
The under 12 and the under 17 group. Any recommendations about startups on sports practices,
Yeah.
game schedules? We're talking about baseball, track, lacrosse,
Yeah.
That kind of stuff.
So we're in the same position we were a year ago when we were talking about the same thing and what do we do? I think we've become wiser and have a little more experience in what we can and can't do. So I think outdoor sports there's a lot more liberties that people can take than indoor sports. So I think obviously having an outdoor event, whether it be soccer or baseball or even football, that is a much safer proposition than an indoor activity or event. So it's going to be interesting. I have little ones that play soccer. Outdoors, I don't know if they're going to require masks, but that is always an option. I know my daughter had indoor soccer the past several months, and they practiced and played with masks. And so outdoor, indoor, two different types of sporting activities. And I think outdoors, I think people should certainly feel a higher level of relief participating in.
Okay, so second question, and this one is an interesting one, and this one's coming from me, and it's about a thing called dispersion parameters, and that the moment that we're headed to with COVID-19 essentially distills down to this idea that when the virus disperses now, it's been or will be going in clusters. So the example on this one is just couple weeks ago, we had a powwow in I believe it was North Dakota. It was much larger than the one previous. It was all inside. The same situation, some wore masks, most did, but you had the people wearing the mask under the nose. I think this week would be telling, meaning those folks who are singers and dancers and support family members that go to these indoor events, they become not essentially super spreaders. It's described like you can throw one match on a fire that's has kindling in it, and maybe it works, maybe it doesn't, and maybe the 10th match that'll do it, because that person's the one who's throwing off virus. That's a person who's really social and hits other social events and continues to make the rounds. But they were at one event that was a super spreader event. But just because someone attended a super spreader event doesn't mean they become a super transmitter.
Mm-hmm.
The super transmitter is that person that went to that event, they continue to be social, and they're spreading it at the right time.
Mm-hmm.
So right now, that's a theory, but it's something we're going to have to grapple with in this native to native conversation, because we, in our culture, with these events, even though moving outdoors in the next few weeks,
yeah,
there's still indoor ones coming up. And I was wondering if you had any thoughts about this word or term dispersion parameter, and if that's something reasonable, meaning we have a loved one in our house, they head out to North Dakota, they attend a powwow, and they're coming back home. And boy, any thoughts about this kind of situation? Is this the future of COVID-19 in our communities? or
So,
it blows up in sections instead of a wider dispersion?
so I'll try to answer this kind of in multiple different ways. And so, because in a way you're kind of getting down to what's your personal risk probability you're willing to take. So we know Wisconsin compared to Michigan and Minnesota, it's cooled off in the state of Wisconsin. But when you look at Minnesota and Michigan, these are definitely two hot spots. It's not what I was talking about 5 months ago. It's been the complete reversal. But if there was ever even a more highlighted effort to say individual risk and what are people willing to accept as risk, the main, I think what would be the most principled way of approaching this would be look what vaccinations or not, what are the chances of asymptomatic spread from a vaccinated versus a non-vaccinated person. And I think this, and I have to go back to that very first slide right here in that highlighted yellow, asymptomatic reduction, a 95 to 72% reduction in transmitting if you get vaccinated with Pfizer or Moderna or Johnson & Johnson. So to go from 0 to 95% reduction, that's a big difference between maybe a individual getting COVID versus an outbreak. And we know what outbreaks look like. So that's, I'm trying to get to an answer. I'm not sure if I'm getting to what you need.
So what I'm addressing is, so if in this time, if these flare-ups if this is gonna move to flare-ups in certain areas, we got people that are going to super spreader events.
Mm-hmm.
So specifically, actually what another dancer was talking to me about was when they go home and they do this because they say, hey man, this is my mental health, this is what I do for my medicine. And I didn't tell him he was wrong for going, but his question was, should I wear a mask and for how long once I come back? In all cases, do I do that, or I just do it in some cases? And my answer to him was, look at the incubation rate and for sure wear that mask during that time, because we don't have to wear masks in Wisconsin anymore. I know our signal goes out to lots of places, but that was my advice for him. So that's what's coming up is these powwows. There are going to be a lot of people. If what you're saying is right, 57%, that's 43% not vaccinated. And it doesn't mean they're going to be 43% are not vaccinated at the event. Usually people that come to these powwows are socially connected, socially aware, but still, it feels like putting bullets in the gun and spinning the chamber.
Yeah.
So if we go to these events, should we be wearing masks to avoid becoming that super transmitter, and for how long?
The short answer is yes, wear a mask, and wear a mask during that social gathering, because that's the highest congregation of your risk is all coming together. If you want to minimize, even if you, I would recommend if you haven't gotten vaccine, yeah, absolutely wear your mask. If you've gotten your vaccine, your chances are a lot less, but they're not zero. And so there's always a risk. There's always a risk. And, people are still getting COVID even after getting vaccinated. So it's not 100%, but it dramatically goes down if you do. And even if you've gotten vaccinated or not gotten vaccinated, in that type of gathering, absolutely wear a mask.
We're at our place of just a little bit past an hour. We said we'd be good to your time. Obviously, the clinic's got a lot of things going on with vaccination. We got a lot of ground to cover up. Even just a week off meant we're kind of behind the curve with current information. You did your best, but there's more to come. So last words for today, and thank you for your time. And I think this is 54 or 55 weeks.
Yeah.
We'll still need it because it's still there.
Yes.
Because I took care of me.
Mm-hmm.
Doesn't mean we're taking care of the us. All right, Dr. Ignace, your last words for our session.
So without a doubt, COVID has stuck its neck out again. And it's sticking out in different ways and different variants, and still lingering, still hanging around. I know efforts in Indian country have been to increase our rates of vaccinations and get people protected, and that's happened. And we would obviously like to see a higher percentage of individuals do get their immunization. This is just a consistent reminder how important it is, especially in aggregated social confines of continue to wear that mask. Things are going to change, and things are swinging in a way that makes me a little uncomfortable as to what the next couple weeks are going to be. We've done a great job in being able to help the Milwaukee community and the natives here. We still have much to do, and I don't want to give the sense that people should let their guard down, because we're still in that critical period of, we're seeing a trend upwards here in Wisconsin, and it is a collective effort of everyone to kind of do our part, so to speak, in how we want to impact our communities. So continue to wear your mask. If you have that opportunity to get a vaccine, I would suggest taking it, and still practice social distancing and washing your hands. So we'll be back. I'm glad to be back. I'm happy to be able to give this information to folks. So until next time, everyone stay strong.